Good afternoon. Assalamu alaikum. My best wishes to all the students who will be watching this video. So today we'll be discussing national health policy. So in this I will be covering the national policy, going into evolution of national policy, and discussing some of the important aspects of the latest national policy. Uh, the objectives that I have for this session are that by the end of this session, the people who watch this video and the students, they should be able to describe need for health policy, describe the evolution of net policy in India, then you should be able to describe the components of National Policy 2007, the latest version of health policy. Okay, so we start with what is a policy basically. So policies basically are courses or principles of action adopted for or proposed by government. That means it's basically a guideline. It's a guideline that needs to be followed, which needs to be followed to achieve a certain objective, achieve certain goals, and develop certain activities, how these goals can be developed and achieved. Now, as far as national policy is concerned, it's actually a statement enunciated by the government, so in this case, Government of India, as a blueprint for further action about the manner in which the tasks related to the health and allied subjects are to be performed. Because at the end of the day, we want to achieve good health for the community or living in the country. So, but then the question arises, why do we need a policy? People are already doing some work in the health field, we have other things going on. So they would do what they're supposed to do. Why do we need a policy at the very outset? So the reasons for the policy are that we all know that we are short of resources. So therefore, the something that we require, we may not be always having at disposal. We need to set priorities. So the government policies help us to set priorities and allocate resources to achieve objectives. Health policies are intended to achieve a level of health status for most of the persons. So they're focusing on most of our population, so we're able to help them. So in this case, we'll have to prioritize, find out where the problem lies, and then focus on that particular group. Then the policies, obviously, as they are initiated by the government, have to be followed by the people at the lower level. Therefore, these policies need what we call as a legal backup. So these policies are adopted and formulated and accepted and then passed. Therefore, these policies have a legal binding on the people who are in the hierarchy. Those who are in the government sector or in private sector will have to follow the policy guidelines. That's why we need a policy. Okay. Now, if you look at the evolution, since India is one of the countries in the world who have a policy, have been having policies in this field for long back. So it was in 1977 when the Alma Declaration was signed, and India was also a dignitary, and they formulated a goal of what's called as a health for all by 2000 AD. And since India was a signatory to that document, they had to follow the document as per the requirements of that health for all strategy. India formulated their first national health policy in 1983. Then there were some changes required as we found that over the years things have changed. Therefore, the revision was brought in 2002. So we had another policy, national policy in 2002. Then lately, as we have gone through evaluating, reviewing the policies and the programs and outcomes of these policies, we found that certain targets had not been achieved. But therefore, the policy revision was, contemplated in 2015, and the policy document was approved by the cabinet in March 2017. Is the latest version of policy that we are having. If you look at the national policy 1983, the first one that was formulated, there was a departure from a curative model to a more holistic approach. We'll be having what we call as a more comprehensive health, really focusing on prevention, launch, promotion, rehabilitation aspects also. And the policy in 1983 recommended a decentralized system of healthcare, where the most of the healthcare, because previously we knew that it was concentrated in the cities. I want healthcare to be in the peripheral areas with well established health system and all the infrastructure and facilities available. Then this formulated that the healthcare has to be low cost, should be more reliance on paramedics, and we need to work for better community participation. So there is better ownership of the services and then the use of volunteers also wherever and whenever they're required. Then there was stress on expansion of private sector also because private sector is going, the economy of the country was improving, the purchasing power of the mass was improving, and there was a need that the government obviously would not be able to cater to all the needs of the population. The private sector was required, and there was a stress on the expansion of the private sector. The targets were spelled out primarily, which were demographic in nature, so in terms of the fertility indicators and the mortality indicators, what they want to achieve by the end of a certain time period. And some of the policy initiatives outlined in the NHP, they achieved results. We were able to bring in some changes. There was improvement over the years in life expectancy. Youth birth rate has decreased. Youth death rate has decreased. Infant mortality rate, total fertility rate, malaria cases, leprosy cases, they've gone down. And there have been achievements, substantial achievements, following the formulation and the implementation of this policy. And other programs were followed by following this policy. Then we had a 2002 policy because some of the things that were formulated in 1993 policy were, say, primarily what they want to achieve is most of these goals for primary healthcare, which was required a lot of investment, which they found was not realistic. There were some changes were brought, even though there was still stress on primarily on comprehensive primary healthcare. They wanted to stress on health volunteers, then stress on a well worked out reference system because the people who are referred to higher level centers should have only uh, proper referral. Otherwise, there is unnecessary undue load on the higher levels of healthcare, the tertiary care. And most patients which can be managed in primary healthcare, they end up with the tertiary healthcare. Then there was initiative of integrated network of evenly spread specialty and specialty services, both in urban areas as well as in rural areas. Wherever it's required, they should be there. This was stressed in the policy document. Now, if we look at this, some of the strategies adopted nationally, it's a very comprehensive approach. You can see it ranges from they looked at the financial resources for health, the delivery of public health programs, role of self-government, local governments, specialists, especially who will be needing, especially public health, who will be taking care of these programs and policies, ensuring these policies are properly implemented. Then urban health, in the health education and behavioral change communication, role of civil society in health, their own health needs, how they can assist it, how they can help us to improve the health statistics, the paramedical discipline, the medical ethics, the equitable distribution of health, then public health infrastructure can be improved, then extension of public health services, then having norms for public health care, education of healthcare professionals, that quality has to improve, nursing personnel, family drugs, mental health, health research, then those focus on private sector, how private sector can be developed, but importantly, to take care that private sector is not only developed, but it's properly regulated also. Then there was stress on national disease surveillance network, women's health, quality standards, and environmental occupational health. Now we can see this theme, the policy document, very comprehensive. It include almost include everything that has to be part of the health sector, part of even beyond health sector, help us to improve health of our community. Now, in again recently we had a policy revision. The question arises: why do we need a revision again? Now there are some reasons this policy revision was required. One, the health priorities are changing. There is a what's called epidemiological transition. Since we all know that communicable diseases, infant mortality, maternal mortality, they're going down. But on the other hand, some of the diseases of the affluent world, the non-communicable diseases, are on the rise. And therefore, to take care of this priority, of this changing scenario landscape, there was a policy revision required. The second thing is the emergence of private health industry. We all know it's growing at a very high speed because of the improvement, increase the purchasing power of people and the preferences people have. And at the same time, we accept that the government sector will not be able to address all the health needs. So people prefer to go to the private sector. So to take care of the private sector, helping its expansion, but at the same time, the government has to do the role of the regulator, what's called as stewardship. That required some policy change for to bring in this kind of regulations and take care of the private industry. And third, the out of pocket expenditure is growing because people are preferring to go to private sector, which obviously is primarily driven by profit. So it actually strains their pocket, and there is a it's called as a catastrophic expenditure. It's a large proportion of poverty or population that's pushed into poverty because of health expenditure. That part also has to be addressed because somehow we'll need to reduce stress on the pocket for the poor, which is saved from these catastrophic health expenditure. Then you have economic growth. Recently, there has been a double-digit growth in India for the last many years now. Therefore, the physical capacity of the country is there, so which demands that the health system, healthcare system, and life sectors can be expanded. Therefore, policy change is required. So these are primarily reasons why the policy revision was there. While the health priorities are changing, there's an emergence of our private health sector, and the out-of-pocket expenditure increasing, and economic growth and the improved fiscal capacity of the country demanded that policy revision. So the objectives of the 2017 health policy, which the last one that we had, the main aim obviously is to achieve universal health coverage and deliver quality healthcare services to and at affordable cost. That's important. And the specific objectives, one is to improve the population health through concerted policy action, reduce out-of-pocket expenditure, ensure universal availability of healthcare, ensure user access to drugs, diagnostics, emergency care. What policy basically is to make them free. It should not be user charges. Make diagnostics, emergency care, essential drugs free to all citizens in the country. Improve access and affordability using public-private partnership modes so that wherever the government is not able to take care, private sector would be involved. Influence growth of private health sector industry and medical technologies. So we want to improve extension of that side, but at the same time under proper guidance and regulation from the government. Now, if you look at the main areas of focus in the NHP 2017 document, we have the stress on increasing public health expenditure to 2.5% from the current 1.15%, ensuring 2,000 beds per million population. Then we have a Swasth Nagarik Abhiyan, just to prevention of disease and promotion of good health, involving the masses, from selective primary health care services to more comprehensive health care, making healthcare accessible and affordable. That's very important. And empowering citizens, ensuring periodic examination of healthcare institutions, quality is maintained, and people are given the best possible available quality of healthcare. And establish a national healthcare standards organization, which will be looking into all these aspects of care, of quality of care given to the masses, and develop a national health information architecture, teleconcentration, where we have a national level of health information network, which will take care of the needs of the health statistics, so which will be required for proper planning and monitoring. And then we need medical pluralism. That means people should have access, should have the ability to use more than one system of medicine, wherever and wherever they need. Okay, if you look at the targets laid down in HP 2017, they are in terms of, say, some of the targets in terms of health and program impact, like improving health life expectancy, reducing total rate, maternal mortality ratio, infant mortality rate, neonatal mortality rate, under 5 mortality rate. And some of these objectives are almost there. The maternal mortality ratio is something around 120 now. By 2020, we're already there. So something, many things are achieved. We're moving towards the targets and achieve and maintain elimination of states of leprosy, achieve global target HIV/AIDS. What is the 1990 goal that has to be done? Who is working on this? And then cure rate of new spreading basis more than 85%, while the policy intends to achieve elimination of tuberculosis by 2025. So these are the targets related to health and program impact. Then have targets related to health systems performance. In this case, targets like increasing intelligence of public health facilities by 50% by 2025, sustain agency coverage as it is there above 90%, ensure skilled attendance at birth, complete immunization of newborns by 1 year of age, meet need for family planning, reduce prevalence of tobacco, reduce prevalence of stunting and revive children, and improve access to safe water. And in fact, there are other targets which are across sectors like nutrition, improving, you know, people have access to facilities like water, sanitation. Then your targets related to health system strengthening, say health expenditure, needs to increase, which is currently around 1.15% to 2.5%. Then increase state sector health spending of their budget of more than 80%. The decreased proportion of households facing terrestrial health expenditure of 25%. Availability of paramedics and doctors as per the Indian public health standard norms in high priority districts. Establish a national health information network. It's very, very important that you provide for the needs of the health information, health statistics which are required for planning and monitoring of healthcare services. Then, if you look at the thrust areas for policy implementation, so primarily it's ensuring adequate treatment, which will be by means of expenditure on health, then preventing and promoting health, which will take care of many aspects like we have the promotion sanitation campaigns, we have health promotion activities, reducing tobacco use, and other things. Then organization of public health delivery system will need to reorganize, look at public health system, both at the primary level, secondary level, tertiary level, and even looking at healthcare level provided urban areas, rural areas. We need to bring in certain chains. Then national programs have to be augmented. Their cost delivery as well as the quality needs to be improved. So, if we summarize this, what we were discussing for the last 2 minutes is that we looked at the policy, why we need a policy, what does a policy mean actually, why we need policy, and how policies evolved from 1983 to 2002 to 2017. Things have changed. Obviously, primary objective of all the policies has been to achieve good health for all the citizens of the country. A lot has been achieved, a lot needs to be achieved, and we need to completely, continuously strive for achieving better, improving health of the masses. Thank you very much.